Hello and welcome to the Diabetes Download, brought to you by Cornerstones for Care. When someone in a relationship is living with type 2 diabetes and the other person in the relationship is trying to be supportive with respect to their diabetes treatment, how well do they communicate? Here to talk about it on a very personal level is Arlen, who is living with type 2 diabetes, and her husband, Claude, along with the expertise of Dr. Cece Klaus-Ehlers, a licensed psychologist who has experience working with families dealing with diabetes.
It's great to be here.
Thank you so much, all of you, for joining us.
Thank you for having us.
How long have you been married?
We've been married for 25 years.
And how long have you had the diabetes?
I've had diabetes for 13 years now.
Did everything change once you heard the diagnosis between the two of you?
We've gone through cycles with everything. We go on during times that we're on the same page and everything's going great. And then there are times where it's not so great and we just have to, try and get back into tune with each other and really try to support the good goals that I have for myself.
We do a lot of walking together, especially when the weather's good. And I gotta say, I'm very proud of you, because even if I come home exhausted or my back hurts, Arlen's motivated now. You'll go to the gym. We've enjoyed the gym as a family. We try to go together as often as possible. And I try not to bring the wrong types of food into the house.
Food, we know, food management, huge part of diabetes. But besides food, how else can care partners help one another with diabetes management?
So I think we can look at it as food being one aspect of a larger picture, and really looking at this on a holistic level. So we want to look at food, we want to look at medication, we want to look at staying active, doing exercising and doing activities together, and also monitoring blood sugar. So really looking at that whole picture.
For years, I didn't know what medication Arlen was on. So I finally admitted, I said, Arlen, you know what? I don't know what you're on. What if something happens to your sugar and someone asks me a question? I don't know what to do. So Arlen wrote everything down on an index card, which I still keep in my wallet, and I also have it in my notepad so that I can refer to it and I know the exact dosage and when you take it, because it's very important to know what kind of medication you're on to make sure all the levels are good.
So what you're really saying is that this is an us thing, that you're in this together, that every day you are strategizing, dealing with this together.
Which is really great to know, that someone is caring about you and really understands what you're going through.
So you guys are constantly communicating.
Oh, yeah.
Definitely, many times throughout the day. And through texting, through phone calls. We have very busy lifestyles, as everyone does, but we do definitely try to maintain that communication constantly.
Well, I loved how you talked about you stay in touch during the day through texting, and then, Claude, you'll check in with Arlen after an appointment, so it's kind of like a check-in after the checkup type of thing. That's really nice. I think that's a really positive thing that you're doing in your relationship. I also think it's wonderful that you can identify that this can be difficult sometimes.
Have you ever felt that he's overstepped and is in your way?
Well, one wonderful thing that I have to say about my husband is that he has never been the diabetes police with me. And that, I feel, is very, very important for a caretaker. Not to feel that you're the police and you're policing every activity that that person is doing, or that everything that that person is eating. Instead, I find that my husband is very positive, and he encourages me, and he, instead of saying things like you shouldn't and you can't, he'll say, well, how about let's try this and let's do that, and give me suggestions which are much more helpful in controlling my diabetes. And I really am very thankful for that.
I imagine that it's so individual to each couple. What do you need from me? What I need from you? Because not everybody's the same. What other ways can people check up, and how do they establish where those parameters are so that it doesn't feel like you're becoming my diabetes police?
Right. So I think one of the things for couples to keep in mind is that the needs can change over time. There may be times that you might want more from your care partner. There may be times where you want less. There may be times where you feel you can give more. There may be times where you feel you can give less. It's okay to say how you're feeling.
If I'm not honest with what I'm going through, I'm hurting myself. So I want to be completely open and honest with Claude and tell him everything that is going on.
Right.
And that is the best, honesty is the best policy.
I want to be there for you, so if you're not honest, I'm not going to know exactly what's going on. So I do ask questions, and we talk about it.
I really appreciate these guys. They have such a
really
caring,
nice.
compassionate relationship. Thank you so much for coming.
Oh, thank you.
And for sharing
you.
your story.
Thank you
And for
so
being an
much.
example to other people trying to work it out. And now Cece has a few more tips to help you work it out.
One thing I'd like to speak to is the importance of being honest with your loved one and yourself about what kind of support you feel able to provide. As a care partner, you may not feel able to give the kind of support your loved one asks for all the time. It happens. And the pressure is on to want to do the right things to stand by your loved one 24/7, 365. Once again, give and take can be so helpful. Let one another know how you're doing. Understand that expectations can change. As we've noted, levels of involvement and expectations can change. The two of you can change to meet these challenges by talking honestly with each other. As a care partner, being honest about what you feel you can't do doesn't mean that you care less. If anything, this kind of honesty almost says that you care more.
To recap, what have we learned in this Care Confidential segment of the Diabetes Download? 1, good communication is an us thing. It goes both ways. 2, there's more to effective care partnering than just simply watching out for food choices. Keeping each other in the loop about testing, about medication, and about taking medication as the doctor prescribes plays a big part too. And 3, be honest with your loved one and yourself about what kind of support you feel able to provide. It is all part of the 4 cornerstones of diabetes care: healthy eating, being active, medicine, and tracking blood sugar. And while we're on the topic, let's not forget how important it is to be involved with your loved one's diabetes care team.